Hello people, this video is on digoxin. Digoxin is a cardiac glycoside that is obtained from the digitalis plant or the foxglove plant. Okay, now let us see about the mechanism of action of this particular drug. This digoxin is an inhibitor of sodium potassium ATPase pump. It's an inhibitor of sodium potassium ATPase pump. And for understanding the mechanism of action of digoxin, we have to understand the operation of these two different transport mechanisms which exist in the myocyte cell membrane. In the myocyte cell membrane, we are bothered about a sodium potassium ATPase pump and a sodium calcium exchanger. Okay, the sodium potassium ATPase pump pumps out sodium ions from inside the myocyte into the extracellular fluid. Okay, and it is responsible for maintaining the sodium gradient here. And this sodium ion, which is there in the ECF, will be taken will enter the myocyte with the help of sodium calcium exchanger in exchange for a calcium ion which leaves the myocyte. Okay, this is what normally occurs. But when I am giving digoxin, what does digoxin do? Digoxin will block the sodium potassium ATPase pump. So this sodium gradient is never created. Because of and if the sodium gradient does not exist, then calcium cannot come out through this transporter, right? Only if the sodium gradient is there, calcium can leave the myocyte in exchange for a sodium ion. That process cannot occur, right? So calcium will accumulate inside the cardiac myocyte. Intracellular calcium concentration will increasing the cardiac contractility, or this is responsible for positive inotropism, in other words. Okay, and digoxin also increases the vagal tone, and because it increases the vagal tone, it decreases the heart rate and decreases the myocardial oxygen demand. Okay, and digoxin slows down AV nodal conduction. So these are also some points which you have to keep in mind regarding the mechanism of action. Apart from having this action of positive inotropism, digoxin also increases the vagal tone, decreases the heart rate, and slows down the AV nodal conduction. Now let us see about some uses of digoxin. The most common indication for digoxin is its use for heart failure. And for this purpose, the desired serum concentration is 0.5 to 0.8 nanogram per ml. Digoxin is a drug that has very low therapeutic index, so serum concentrations have to be monitored. And the desired serum concentration for this purpose happens to be 0.5 to 0.8 nanogram per ml. Okay, for atrial fibrillation also digoxin can be used, and if it is used, a higher serum concentration can be tolerated. Now, coming to the adverse effects and toxicity of digoxin, it has numerous very interesting toxicity manifestations. Okay, serum concentrations above 1.2 nanogram per ml are associated with increased mortality. Okay, that is one point which was proven by research. And digoxin overdosing commonly manifests itself with these three symptoms. One is there can be arrhythmias, there can be gastrointestinal symptoms, or there can be neurotoxic symptoms. Arrhythmias happen to be the most common manifestation seen in about 90% of the people with digoxin toxicity. Now, the question arises, what kind of arrhythmias are to be expected? In healthy people, AV block, bradycardia, these kind of arrhythmias are more common. The reason is quite self-explanatory. We saw that digoxin slows down the AV nodal conduction. If that occurs, then AV block and bradycardia can very well occur. So in healthy people, this is the kind of arrhythmia that we can expect. In people with structural heart disease, however, ventricular arrhythmias happen to be more common. Okay. Now, coming to the other side effects, we have gastrointestinal side effects. Due to stimulation of the area postrema, digoxin can cause anorexia, nausea, and vomiting. Okay. And there are two weird adverse effects that we can expect from digoxin. One is altered color perception. Right. In about 10% of the people, there is yellowish vision, altered color perception, or blurred vision. These kind of manifestations are seen in about 10% of the people, and very rarely, this usually does not occur, there can be spastic contraction of the mesenteric artery that can lead to diarrhea and necrosis of the intestine. This is very rare. Okay. And toxicity. We just now saw the manifestations of digoxin toxicity. How do you think we can treat digoxin toxicity? In most of the cases, just cessation of the therapy would do. That would suffice. But in cases of extreme sinus bradycardia, where there is extreme sinus bradycardia or AV block, we can treat it with atropine 0.5 to 1 milligram IV. Okay. And in tachycardic ventricular arrhythmias and hypokalemia, potassium infusion can be done 40 to 60 millimoles per day. So before doing potassium infusion, it is always good to perform a serum electrolyte panel and make sure that there is no hyperkalemia, and then start potassium infusion. Specific antidote is also available for digoxin toxicity, and that is Digibind. Digibind is obtained from ovine antidigoxin antisera. That is antidigoxin antisera that is formed in sheep. From those antibodies obtained from sheep, the FAB fragments alone are purified, and we are using them for treatment of digoxin toxicity. Okay. And now, finally, what is the relationship between digoxin and serum electrolyte levels? We have to understand that digoxin blocks the sodium-potassium ATPase pump. How digoxin competes with the potassium to bind to the sodium-potassium ATPase pump. So because of this reason, hypokalemia can predispose the individual to digoxin-induced arrhythmias. And another point to note is that hypercalcemia can potentiate the effect of digoxin, because digoxin increases the calcium concentration inside the myocyte, and hypercalcemia can just potentiate this effect, right? So this is about digoxin and the serum electrolyte levels. Okay. Thank you, and that's it for today. If you like this video, please like, share and subscribe.